All right. So again, good evening, everyone. Thank you for joining us for the last presentation of this series, part 4 of our 4-part series. Tonight, we're going to talk about Medicare and other types of insurance options that might be available to you. Hopefully, everybody got the email that I sent out earlier this afternoon that included the slides and some handouts that go along with this presentation. Tonight's presentation should go fairly quickly. We've got a lot of information to cover, but it goes, like I said, fairly quickly. I will pause at the end of each topic to see if anybody has questions. If you have questions, when I pause, you're welcome to simply unmute and ask your question. Otherwise, you're welcome to type your question into the chat box at any time, and I will address them as we go. So with that, I will go ahead and get started. So again, tonight we have part 4 of our 4-part series. This is in partnership with our agency, the Pikes Peak Area Agency on Aging, and the mission of the Area Agency on Aging is to work with partner governments within our 3-county region to coordinate and develop systems that allow people to stay in their homes and in the community for as long as possible. I am the coordinator for the SHIP program through the Area Agency on Aging. The SHIP program is the federally funded program that's designed to provide information and education on all things Medicare. All services are at no cost. We do not sell any insurance or promote any specific insurance product or company. Every county and every state does have access to a SHIP program, at the very least by toll-free number within that state. On this slide, I have indicated the 9 counties that our office serves in Colorado, as well as our statewide toll-free number and our local Colorado Springs number. Quick review of what we've already talked about in the last 3 weeks. First week, we talked about eligibility into original Medicare A and B, costs of A and B, coverages, and benefits. In week 2, we went over the options you have for coverage to go with Medicare A and B, such as Medigap or Medicare supplements and Medicare Advantage plans. And then last week, we focused on Medicare Part D, the newest benefit of Medicare for prescription drug coverage. And tonight, we're going to be talking about all other kinds of coverage that might be applicable to someone's situation, including employer coverage, retiree coverage, military coverage, Medicaid, and the marketplace. And we are going to start with employer coverage. So many people these days are continuing to work past age 65. And through that employment, they have employer health group coverage that covers themselves and or their spouse or family members. If you are actively employed, and I've mentioned this in previous weeks, if you are actively employed and have employer group health coverage, when you become eligible for Medicare at age 65, you have the option in most cases to delay enrollment into Medicare in favor of that employer coverage as long as you are actively working. By delaying enrollment into Medicare, you're not duplicating coverage, you're not paying for 2 types of insurance. And as long as the employer that you're working for has 20 or more employees, you can do that without penalty. Once that employment ends and that employer coverage ends, you would have that extended window of opportunity, a total of 8 months, to enroll in Medicare without penalty. Employers cannot require that you enroll in Medicare. They cannot entice you to enroll in Medicare. They cannot encourage you or pay for you to enroll in Medicare. They have to allow you to continue that employer coverage as if Medicare never came up. So again, you can continue the employer coverage, or you can enroll in Medicare and have Medicare and employer coverage. Many people these days do tend to enroll in Medicare Part A, even though they are still actively employed, because Medicare Part A for most of us has no monthly premium, as we've mentioned before. But again, it's not required that you enroll in any part of Medicare when you become eligible if you're actively employed and have employer group health coverage, or you're the spouse of someone actively employed with employer group health coverage. If you are actively employed and you are going to stop that employment, or that employment stops, or you plan on retiring prior to turning age 65 or becoming eligible for Medicare, you would still have the option of using COBRA coverage. COBRA stands for Consolidated Omnibus Budget Reconciliation Act. Basically, it's just a continuation of coverage, a continuation of your employer coverage for up to 18 months in most cases, so that you have health insurance between Medicare and active employment. This coverage must be by law offered to any employee who either is whose employment either ends, or they are experiencing a loss or a reduction in work or hours that causes them to lose their eligibility to have the employer coverage. COBRA coverage can also cover spouse and family, especially in situations where either the employee loses their eligibility for whatever reason, or that employee becomes entitled and enrolled in Medicare. If there's a divorce in the family, a death of the employee that was covering the spouse or family, or loss of dependent child status. For employees who are no longer employed and eligible for that employer coverage, you do have to be careful about enrolling in COBRA if you are becoming eligible for Medicare. So there's two ways that could go. If you are entitled and eligible for Medicare prior to losing employment and losing employer coverage, you can enroll in COBRA. However, if you delayed enrollment into Medicare and you choose to enroll in COBRA instead of Medicare when you lose that employer coverage, keep in mind that that COBRA coverage is not considered a creditable reason or a good enough excuse for not enrolling in Medicare because you were eligible. It's not active employer health coverage. So if you use COBRA instead of enrolling in Medicare in this situation, keep in mind that you could be penalized and pay more in premiums for delayed enrollment because you went in favor of the COBRA instead. Also keep in mind that even if you don't use COBRA, your spouse and dependents can if they're not yet eligible for Medicare. If you are on COBRA, say you quit working or you lose employment coverage, and you go on COBRA because you're not yet eligible for Medicare, COBRA, that's the whole point of COBRA, is that you have continuous coverage because you've lost employment, but you're not quite eligible for Medicare. As long as you're not eligible for Medicare, you can continue the COBRA coverage for as long as it lasts. And typically, again, that's for most people 8 months or 18 months. As soon as you become eligible for Medicare while you're on COBRA, you are strongly, strongly encouraged to enroll in Medicare. Once the COBRA insurer finds out that you were eligible for Medicare, they can either terminate benefits or they can change the coverage of those benefits to act as secondary to Medicare, regardless of whether you enroll in Medicare. So again, it's not considered credible coverage for delayed enrollment into Medicare under any circumstance. So as soon as Medicare eligibility is available to you, typically you were strongly, strongly encouraged to enroll in Medicare versus staying in COBRA. There are some exceptions to the rules. Unfortunately, COBRA rules in some situations can be very confusing and convoluted. So, if you are in a situation where the rules aren't quite clear, you're always welcome to give us a call. We can help guide you on that, on those issues. May take us a minute to look them up because they're confusing and convoluted to us as well, but we're happy to help with that. And with that, I will do a quick pause to see if anybody has any questions. Again, you can type a question into the chat or simply unmute and ask your question. All right, hearing no questions. So now we're going to touch briefly on employer retirement coverage. So this is a scenario where you have been employed with the same employer for long enough amount of time to be eligible for any retirement health benefits that employer may offer. Employer retirement coverage can be a good option for many people eligible and enrolled in Medicare, but you have to keep in mind that employer coverage is significantly different from employer to employer in most cases. Employer options for healthcare after Medicare eligibility, again, can be a very good option, but each individual employer gets to determine exactly what benefits are going to be offered to their retirees. What that means is for every employer retirement plan that I come across, it is slightly different or significantly different than the next one. The only way you're going to be able to know how exactly any retirement health benefit you're being offered is going to work or coordinate with Medicare is to talk to the employer, their HR department, or if they've hired a third-party administrator for those benefits, talk to those benefits department. Employers, again, can customize their coverage. And I have seen coverage customized to look very similar to standardized supplements that we talked about a couple of weeks ago, or standardized Medicare Advantage plans. I have seen employers who simply hire a third party to sell you a supplement, a standardized supplement or Medicare Advantage plan. I've also seen them where they've structured their benefits as a cash subsidy so that they'll set aside, $2,000 a year for you to use to pay premiums to buy your own insurance. Or you can submit your insurance premium bill every month and get reimbursed. I've seen it where, they offer very specialized and customized insurance options based on the model of a standard supplement or standard Advantage plan, but do not work anywhere near the way a standard supplement or Advantage plan would work. The other thing that you'd want to be aware of and would be a very important benefit to know about is whether or not that plan offers any drug coverage and whether or not that drug coverage, if offered, is considered creditable compared to Medicare Part D. Employers are by law required to provide any employee or retiree with a notice every year that states whether or not any drug benefit that they offer is considered creditable compared to Part D. Most employers are going to offer what would be considered creditable coverage, but not all of them. So you really need to be proactive in making sure that the drug coverage that you may be offered is considered creditable. Sometimes the health benefit can be really good and the drug coverage is not. So it really pays to be proactive and ask those kinds of questions so that you know what is really being offered to you compared to what you can buy out on the open market. And again, the only way you can do that is by contacting the employer or the benefits administrator directly. So again, that being said, always want to double check the drug coverage if that's being offered and determine whether it's creditable. Even if it's considered creditable, you may want to go a step further and compare that to the costs with a Part D. Compare the copays, compare any deductibles, compare any premium that you're paying for that coverage versus a Part D. Sometimes you're going to find savings in one direction, sometimes the other. Based on the benefits for healthcare that these plans may be offering you, that are hopefully designed specifically to coordinate with any Medicare benefit you may have, you may also want to compare whatever premium you're asked to pay for that coverage to what you can buy on the open market. Sometimes I see employer plans that have decent benefits that coordinate with Medicare, but the premiums are twice what you would pay if you went out on your own. Even if it includes drug coverage, the premium can still be rather significant depending on the employer. So it really pays to compare apples to apples to make sure you're really getting the most effective and best coverage that you can have. Also, you want to know what kind of coverage the employer is offering you. Is it an HMO through an Advantage plan where you are limited to who you can see and where you can go? Or is it an open network? You can go anywhere. You don't have to worry about HMO type restrictions such as requiring prior authorization or referrals or, those kinds of things. Again, getting information is going to be key. We do help with reviewing retirement options in our office, and we are happy to do so, but you've got to have something to show us so that we can kind of help figure it out. Most of the time when you're offered this kind of benefit, you are given some sort of packet that kind of outlines those benefits and coverages. And again, we're happy to review any of that with you at any time so that you are fully understanding the pros and cons of your options. If you are retired military, and of course here in Colorado Springs, where our office is located, we are surrounded by military bases, so we do have a high number of military retirees in our area. If you are retired military, meaning you have put in that 20 or more years in service, you are eligible for TriCare for Life when you become eligible for Medicare. Whether you're using TriCare now, before Medicare, or not, when you are enrolled in Medicare, you do become eligible for the TriCare for Life coverage. The TriCare for Life coverage works very much like a Medicare supplement in that it's designed to simply pay any balance or deductible that Medicare A and B left over. And it includes, of course, creditable drug coverage, all at no monthly cost. So there is no cost to have that coverage, and it does coordinate with Medicare. But unless you are actively employed with employer coverage when you become eligible as a military retiree, if you're not actively employed when you become eligible for Medicare, the military does require that you enroll in Medicare in order to access the TriCare for Life. If you don't enroll, then you do risk losing your option to have TriCare benefits. So once you're eligible for Medicare, again, if you're not actively employed with employer coverage, you're strongly encouraged to contact the DEERS office of whatever branch you served in and let them know that your Medicare is going into effect. DEERS office has gotten very, very good at providing notice in the mail up to 3 months prior to your eligibility or month of your Medicare would go into effect, so that they pretty much know that you're eligible for Medicare, but you would still be required to confirm that with them so that they can switch TriCare to TriCare for Life. And I see a hand raised. Do I have a question?
Yes, Roma, you talk about retired military, but you didn't mention anything about dependents who already carry TriCare. Dependents of somebody who's in the military.
So is that carry TriCare pre-Medicare?
Yes, so I'm a spouse of a retired service member who's now deceased. And so I have TriCare. Does this apply to me as well?
Absolutely. If you want to obtain the TriCare benefits, when you become eligible and enrolled in Medicare, contact DEERS, confirm that, and your TriCare changes from TriCare to TriCare for Life.
Okay.
Again, I think I mentioned this last week or two, between Medicare and TriCare for Life, that is literally the best coverage anybody can have in this country right now.
Awesome.
You really wouldn't need anything else to go with it. You wouldn't need a Part D, you wouldn't need a supplement or an Advantage plan. Between Medicare and TriCare, you truly do have the best coverage available in this country today.
Okay, thank you.
Okay, so just be very, very mindful of that. It is definitely worth taking advantage of those TriCare benefits. They were earned, they were hard earned, and definitely worth taking advantage of when you are eligible for them. If you wanted more information regarding those benefits, the TriCare website, and I've shown that at the bottom of the slide, actually does a really good job of explaining Medicare and how Medicare and TriCare interact and coordinate with each other. So there's a lot of good information on that website. If you are not retired military, but you are a veteran, you may be accessing the VA for services. Again, VA benefits are not technically considered healthcare, but many people do access that care as their primary vehicle of healthcare. And I may have mentioned before, I do get a lot of veterans who ask whether or not they should or have to enroll in Medicare. There are definite advantages to enrolling in Medicare, even if you access the VA services for all your healthcare needs. But the downside is you do have to pay that premium to have Medicare Part B. If you're accessing the VA health system and you have pharmacy benefit, VA pharmacy benefits are considered creditable for Medicare purposes, so you would not have to enroll in a Part D. And you would have the opportunity to enroll in a Part D in the future if you chose to do so or needed to do so, and there would be no penalty. And you can have a Part D and use VA pharmacy at the same time. I don't know how you would necessarily need to do that or want to do that, but it is something you could do. Because that VA pharmacy benefit is considered creditable, obviously you wouldn't need to purchase Part D if you didn't have to. But Part B, VA is not considered creditable. So if someone chooses not to enroll in Medicare in favor of using the VA for all needs, which you can do, keep in mind that if for any reason in the future you decided that having Medicare would be a good thing or have advantages for you, you can enroll during general enrollment period every year, but you will be penalized for not having enrolled when you first became eligible. Because again, VA is not considered healthcare, and it's certainly not considered health benefits through active employment. Again, the advantages of using Medicare or having Medicare, even if you're accessing VA for all needs, is that Medicare is good everywhere. Medicare is good for everything. It does not have the limitations of only providing care for service-connected issues. It has the ability for you to use services everywhere where VA facilities may not always be readily available to someone if you are not within your area here. So there can be benefits to it, but again, you do have to pay that Part B premium in order to have those benefits. And also keep in mind, even if you do enroll in Medicare, Medicare and the VA do not coordinate with each other. So Medicare is not going to pick up any costs associated with your VA care. VA is not typically going to pick up any costs associated with the care you get in the community and use your Medicare with. And you cannot use Medicare at the VA. So pros and cons, and it's something that people really need to consider very carefully. I certainly would never suggest or encourage anybody that they shouldn't use their VA benefits. Again, that's a benefit that you've earned, and there are a lot of benefits to that. But there are also benefits to having Medicare as well. Again, I've listed the website on the bottom of the slide. If you wanted more information, the VA does a pretty good job of addressing Medicare eligibility. So you can get more information. Or of course, you're always welcome to give us a call, and we're happy to talk to you about those options as well. I'll take a quick pause to see if there's any questions about any of that. All right, I'm not hearing any questions or seeing any in the chat, so we will move on. So next, we're going to talk briefly about Medicaid. Now, Medicaid, there is a lot of confusion about what Medicaid is and who can have it. There's sometimes a lot of confusion about the difference between Medicare and Medicaid. My best rule of thumb when I'm describing the difference between Medicare and Medicaid is that Medicare is a federal benefit that you earn by paying taxes over the course of your lifetime. It is a benefit that you earn so that you will be guaranteed to have that option when you are eligible at 65. Medicaid is basically a needs-based benefit run by the states. So each state's Medicaid program may be a little bit different from their neighbors. It is funded by both federal and state dollars, but it is run at the state level. And it is primarily going to be based on financial eligibility and need. In some cases, it's based on health eligibility and need, but even in those scenarios, the financial eligibility is going to play a bigger part in that picture. 2014, when Affordable Care Act went into effect, that also expanded Medicaid benefits across the country. In most states, that expanded Medicaid benefit is managed by the federal government. In Colorado, we opted to manage our own. We opted to manage our own marketplace as well. So the Affordable Care Act provided health benefit for all people, regardless of pre-existing health concerns. Whereas prior to the Affordable Care Act, if you wanted to purchase private health care, health insurance, you were subject to underwriting. And if you had any sort of pre-existing health issue, you were not likely to be able to purchase coverage. So the only way most people get coverage would either be through employment, their own or their spouses or family member, or through Medicaid. But again, that Affordable Care Act opened up the ability for everybody to purchase health insurance, regardless of pre-existing health issues. Again, most of those programs called marketplaces are managed by the federal government, but Colorado opted to manage our own. As far as Medicaid goes, what people don't understand about the Medicaid programs in most states, I can tell you that in Colorado alone, there are over 40 different kinds of Medicaid. And every one of those options has slightly different eligibility criteria, whether it's physical different criteria or financial different criteria. Each one of those options has different eligibility. So when someone calls and says they have Medicaid, that doesn't tell me a whole lot about what kind of Medicaid they have and how they have it. And that can make a difference on what kind of coverage they have when they become eligible for Medicare. So one of the ways to determine whether or not someone is eligible for Medicaid or the expanded Medicaid benefit is going to be based on finance, on income and assets. There are a couple ways you can find that information out. You can go to the Connect for Health website that I've listed on the slide, and you can start doing the screening tool. Basically, just put in some general information, income, household size, that kind of stuff, and it will tell you whether or not you're eligible to either purchase marketplace coverage. And if you're eligible to purchase marketplace coverage, whether or not you're eligible to get tax subsidies or reduced premiums and copays because you're at a lower income scale, or it'll also tell you if you're eligible to apply for Medicaid instead. What we refer to as MAGI Medicaid, which means modified adjusted gross income Medicaid. That's the expanded Medicaid benefit that is available to anybody between, or basically anybody under age 65, solely based on income, does not look at assets or resources. So it only looks at someone's income, and it provides full Medicaid benefits. If someone is on Medicaid, that kind of Medicaid, and they become eligible and enrolled in Medicare, their eligibility for Medicaid does change. And in order to be eligible to continue any Medicaid program, the state is going to start looking at assets and resources, and the programs and coverage that that person would be eligible for also changes a little bit. So Medicaid can be kind of complicated, and it can be kind of frustrating to figure out, whether or not you're eligible or not. And again, it does vary a little bit from state to state. So a lot of times people move to Colorado for whatever reason, and they just assume that whatever they had were in the state they came from was going to be the exact same thing here. And it's not. Our office and our counselors are very well versed in most all aspects of Medicaid. We do help with Medicaid applications when needed. and we can help determine eligibility. We can certainly help explain the Medicaid programs and what people may or may not be eligible for, or what they may or may not have. And we're happy to do that. But again, keep in mind, if you're on any kind of Medicaid prior to getting Medicare, once you are enrolled in Medicare, that eligibility does change. And you may have to look at those options again. There are some Medicaid programs that are very specifically designed for people who are older, 60 and older, or for people on Medicare. I talked about these programs, the Medicare savings programs, over the last couple of weeks. Medicare savings programs technically aren't Medicaid because they're federally funded programs, and they're only designed to pay Medicare costs, such as the Part B premium. But you apply for those programs through the Medicaid system, through the Department of Human Services. So even though it's not Medicaid, you apply for it through Medicaid. Sometimes it's simply easier to refer to it as Medicaid. There are other programs out there specifically for the older population. Names of these programs are not very complimentary, but OAP, or Old Age Pension, is a program designed for people who are very, very, very low income. And it provides a cash stipend that supplements their Social Security income up to a certain income amount. Anybody who is approved for those kinds of programs will automatically get a Medicaid benefit regardless of Medicare. Medicaid is also primarily used for long-term care services, whether that is home and community-based assistance, where someone comes in and helps you in the home so that you can stay in your home and in the community, or whether or not it's going to help cover your care in an assisted living or a long-term care nursing home, where that benefit can pay the room and board for that service. Each one of these programs, again, has different income levels and asset level criteria, and may have some physical need eligibility criteria that you would have to meet to qualify. We are, again, happy to help answer any questions about these benefits, and we do help with these application processes. And I see a hand raised again. Go ahead.
Roma, the slide earlier said that Medicaid was for anyone under 65 years of age. Does that 65 years apply to everybody in the Medicaid category, or just Magi Medicaid?
So specifically, the Magi Medicaid program is for people who don't qualify for other types of Medicaid, that is not insured most of the time by other means, and is not eligible for Medicare.
Okay.
So someone in their 40s who is working but doesn't have employer coverage can have Magi Medicaid if they're within the income limit. If someone is 18 and getting their first part-time job out of high school, they can qualify and have Magi Medicaid.
So if somebody is 70 years old and has Medicare and Medicaid, long-term care, HCBS, that still continues after the age of 65. It doesn't have anything to do with that age, correct?
Correct. They would not have Magi Medicaid. They have long-term care Medicaid.
Got it. Okay, thank you.
Yep. And that's kind of where the confusion can start coming into play, because of the many, many different kinds of Medicaid somebody can have. And there are situations where people can have multiple types of Medicaid and Medicare, which doesn't help the confusion at all. So people can be eligible for long-term care Medicaid. They can be also enrolled and eligible for the Medicare savings program and have Medicare. And trying to figure out all of that can be, a task sometimes. But again, we have the ability to help people through that process and help people figure out what's going on, and we're happy to do so.
Thank you.
So again, Medicaid can be complicated. We are here to help, is the message. One of the handouts I sent you earlier this afternoon is just a brief one-pager about some of the income eligibility criteria, asset eligibility criteria for some of those programs, the Medicare savings programs, which we have talked about in the last couple of weeks, as well as the income and asset limits for this year for the Part D help. Again, the financial assistance, the extra help or low income subsidy for Part D benefits, income limits are higher than for the Medicare savings, so more people should qualify for help with drug coverage than with the Medicare savings. And again, we help with all of that. And then lastly, we're going to talk about the marketplace. The marketplace, again, is the Affordable Care Act coverage that allows anybody without other health coverage options, regardless of pre-existing health concerns, to purchase health insurance. Colorado opted to manage our own system. We call it Connect for Health. You can go to that website, type in some basic information. You do not have to create an account, and it will tell you what you may qualify for and let you look at the plan options that might be available, as well as the costs associated with that plan. So it's got a good search tool to let you do a little shopping around without actually having to do an application or create an account. The marketplace coverage is private health insurance that you're purchasing out of pocket. So it can be, you definitely want to shop around to make sure you're getting the most coverage for the least amount of costs that you can get. And there are quite a few options to choose from. There's not a huge number of companies to choose from, but each one of those companies offers multiple options, different levels of coverage and cost. By using that kind of search engine through the Connect for Health website, again, it will also let you know if your income is low enough that you might be eligible for reduced costs to have that coverage based on tax credits or premium subsidies, where it either reduces your costs at the time, meaning you pay lower premiums, lower copays, et cetera, as you go, or it reduces your cost in tax credits at the end of the year when you file taxes. Marketplace coverage is subject to annual enrollment period, so you do have to wait for the open enrollment period for this benefit to enroll most of the time, unless you're in a situation where you're being laid off from work and losing your health coverage. That creates a life-change event that would allow you to get into this kind of coverage based on that immediate need, excuse me. But otherwise, you do have to wait for open enrollment, and during that time, you can also compare any changes or any other options that might become available from year to year to make sure, again, you're getting the best coverage for the least amount of dollars every year. Just like with Medicare open enrollment, you want to compare all your options to get the best deal. If you are currently covered by marketplace insurance and you become eligible for Medicare, keep in mind most of the time, once you're eligible for Medicare and you enroll in Medicare, you cannot keep your marketplace coverage. The two are not designed to work together, and they're basically designed to be in place of one another. So if you're eligible for Medicare, you're not needing marketplace coverage, so you're not eligible for it in most cases. However, you can have it. If you choose to keep marketplace coverage and you enroll in Part A of Medicare at minimum, you can do that. We don't encourage it. It's not really the best direction to go in, because Medicare is typically considered better coverage than even the best marketplace benefits. But you can, and if you were getting any sort of tax credits or premium subsidies, those go away. If you're already on Medicare, keep in mind that it is illegal for anybody to sell you marketplace coverage if they know you already have Medicare. And it's illegal for you to purchase that coverage if you know you already have Medicare. And again, you should not be using the marketplace instead of Medicare. Exception to that rule is if you're not entitled to premium-free Part A, meaning you did not have enough work history or enough credits paid into that system to get Part A at no cost, you would have the ability to opt not to enroll in Part A and enroll in Marketplace instead, because the costs between buying Part A and buying Marketplace coverage are kind of similar. So it's not considered a better option necessarily. But regardless, if you choose Marketplace coverage instead of enrolling in Medicare when you're first eligible, keep in mind it does not waive any late penalties if you enroll in Medicare later. Again, the only excuse Social Security accepts for delayed enrollment into Medicare, active employment with employer group coverage, and that's not this. Regardless of whether or not you enroll in Medicare or you choose to have marketplace coverage, when you become enrolled in Medicare, you can still go to the marketplace and shop for dental or dental vision coverage. Because those are not benefits of Medicare, original Medicare, you can actually go out and get dental and vision coverage anywhere you want, in any way or fashion that you want. But the marketplace is one place that you can look to purchase that kind of insurance if you want to. So keep that in mind. It's a good option to look at if you're shopping around for that kind of coverage. And again, marketplace rules can be a little complicated. There, as with all things insurance, there are always exceptions to the rules that people can find themselves falling under. And we are happy to help answer any of those questions or help people understand any of those options. And I think that's all I have for you tonight. Any other questions? All right. So that is all I have for you tonight. Again, hopefully everybody got. Oh, go ahead.
Just one question. Should I, if I want to make an appointment to make this very personalized as to my situation, should I call the number to make an appointment? Is that the best way to do it?
You can either call our local office number or you can shoot an email to the email address on the screen, and we're happy to schedule an appointment. We are, like I mentioned before, we are allowing in-person appointments to be scheduled at this point, but we're also happy to work with you over the phone or by Zoom.
Okay.
Whatever works best for you.
All righty. Thank you.
You're welcome. So again, our contact information, my email address is listed here. You're welcome to contact us with any questions. If you want to schedule an appointment, again, we're open to doing appointments in any fashion that works best for you. And we're always happy to sit down with you one-on-one so that you are totally comfortable in the choices that you make when Medicare becomes an option for you. I started to say, hopefully everybody got the email that I sent out earlier this afternoon that included some additional handouts as well as the slides for tonight's presentation. I do want to say thank you all very much for hanging in there with us for the last 4 weeks. I hope this has been useful information for you. I hope you found it easy to understand. And again, we're happy to answer any questions that may pop up in the meantime, either by phone or by email. And with that, I will ask for questions one more time, and otherwise I will let you all enjoy the rest of your evening.
Thank you so much.
You're most welcome. Thank you for joining us, and hopefully if you have any need, we're going to hear from you.
Thank you, Roma.
Thank you.
Thank you.
Thank you. Everybody have a good evening. Enjoy the rest of your night, and we'll talk to you soon.